Hello, I'm Susan Weinstein, Co-Executive Director at Families for Depression Awareness. Welcome to Isn't That Covered? What Caregivers Need to Know About Mental Health and Insurance. We appreciate you joining us for this webinar, which we expect to be about 75 minutes long. At the conclusion of the webinar, please take a couple of minutes to complete our survey. We'll gladly send you a copy of our Coping with Stress brochure. You'll find the link at the end of the webinar and on our educational webinars page of our website at familyaware.org/trainings. In this webinar, we're providing answers to the questions, what do families need to know about getting insurance? And how can we make the most of our insurance so it pays for the mental health care our loved ones need? We want you to have the information you need to be confident in navigating our patchwork health insurance system, both in choosing a plan that fits your family and following through when the insurance company denies or limits access to a provider, a service, or a medication. This webinar is another way that Families for Depression Awareness is working to help you provide constructive support to your loved one with regard to their mental health and well-being. At the end of the webinar, we hope you feel positioned to support your loved ones in making insurance decisions that are informed and enable them to access the care, providers, and services they need to help them get and stay well. Over the course of the webinar, you'll hear from other people as well. Becky, who's a caregiver to her husband Joe, Hannah Frigand from Healthcare for All, and Wells Wilkinson from Health Law Advocates. We appreciate all of you participating. We believe that you will learn from this webinar regardless of when you watch it. However, we encourage you to first watch our insurance clips on YouTube, which you'll find on our YouTube channel FFDA1. We also suggest that you download and refer to the insurance fact sheet that goes with this webinar in case you want to look up a definition. This can't be a webinar about every aspect of insurance, so we're focusing on equipping you, the caregiver, to be a confident decision maker and informed advocate for your loved one's mental health care. We've broken this down into 5 aspects of what's involved. Understanding your role. What insurance essentials do you need to know? How to utilize the marketplace and choose insurance in other circumstances, such as through your employer. How to appeal and exercise your health insurance rights, and the importance of taking care of yourself. These are not a linear process, but different areas that all play into helping you take on the challenges of health insurance. I do want to note that because Families for Depression Awareness is a national organization, this is a national webinar. We're not going to address the insurance variations from state to state, but we will provide information that can be applied in any state, and we'll be discussing questions to ask, things to look for, and strategies for appealing insurance decisions. These will be generally applicable regardless of where you live. Advocacy for better health care is incredibly important. More than 1 million Americans have lost health coverage since 2016. However, advocacy is not the topic for this webinar. If you're someone who is passionate about healthcare reform and you want to get involved in advocacy about cost, quality, and accessibility of care, we urge you to connect with any of the organizations listed here or find one in your state to help move the needle on Medicaid expansion and access to affordable, high-quality care. And if you watch any news, you'll know that health insurance is changing, but we don't know exactly what the changes will be, and we don't know when they'll happen. So we encourage you to stay up to date on changes. One thing you might do is sign up for newsletters to keep up with developments in insurance and healthcare. These are a few reputable sources you might consider. We're releasing this webinar to coincide with the federal open enrollment period. It's the time that you can renew or choose a different health plan through the marketplace. Here, we're showing the 2020 insurance dates, but this information is applicable for any time you need to choose an insurance plan or exercise your appeal rights. If you're purchasing a 2020 health plan through the federal health insurance marketplace, open enrollment has a short window beginning on Friday, November 1st, 2019, and ending on Sunday, December 15th, 2019. If you're watching this webinar in a later year, assuming the marketplaces are still in operation, you'll want to visit healthcare.gov to get the accurate dates for your current year. If you get your health insurance through your spouse's employer or your own employer, there will be an open enrollment period, though probably not at the same time as federal open enrollment. Whenever your open enrollment period, it's the time to reassess how effective, expensive, and appropriate your coverage has been the previous year, whether any health conditions or healthcare providers have changed, and whether your financial situation has changed. Are your healthcare priorities the same for your family? There are only a few exceptions to getting insurance during open enrollment through the marketplace. If you're of low income and qualify for Medicaid, the open enrollment restriction does not apply to you. You can enroll at any time during the year. Also, if you experience a change in your household status, lose your health insurance, or move away from your current home, you may qualify for a special enrollment period. Otherwise, you need to make your decision in the open enrollment period. We know that navigating health insurance is difficult. There are different states that have different requirements and different insurers with different plans. Even plans provided by a single company may differ in more than cost. They may have different provider networks too. As you likely know, the issues we're talking about in this webinar have a real effect on the health and well-being of individuals and families. I'm going to bring on Becky, who is caregiver to her husband, Joe. Let's hear some of their story.
Our story goes like this. My husband and I had been married for almost 15 years, together for 23 years, had a pretty normal life. Due to a hereditary condition that causes blindness, my husband had been dealing with progressive vision loss since before we were married. But we had always managed, and life really was good. In 2011, though, over a period of a week or so, I noticed he was speaking really fast and that he would try to explain things to me, but he couldn't seem to get to the point. And this was really different behavior for him, but I didn't think too much of it, honestly, because I guess I can't be the only one who sometimes only half listens to a spouse, and I wasn't that concerned. But then his talk became increasingly paranoid to the point where sometimes I thought he was joking, but sadly, he wasn't joking. He woke up early one morning during that time, and I shouldn't even say he woke up because honestly, he hadn't slept for 3 nights. He had had bronchitis. I didn't think it was odd that he wasn't sleeping because he was sick. But anyway, he woke up and I was getting ready for work and he became extremely agitated and delusional. He began screaming and making threats. And he had always been a really even-tempered person, a really kind person, never ever raising his voice. So I knew something was really wrong. I grabbed our dog, I left the house, I got the police, and then he was taken in an ambulance by force to the local hospital. When I called later that morning to check on him, so it happened at 5:30 in the morning when he was taken, and I called the hospital at 10 in the morning after my parents and a bunch of people came to my home to help me out. But the hospital told me he was ready to be released and that I needed to come and get him. And I just couldn't believe that they were going to release him to me without talking to me and without talking to the police about what had happened that morning. I was really scared. He also, at that time, Joe left a message for me, and his voice was just so odd. You know, he said, "I'm ready to come home, come get me," but I knew he wasn't right. And I was really scared, but I didn't think I had a choice, so I drove to the hospital to pick him up. But my presence there sent him into an episode of psychosis that was really extreme, and it got him officially admitted. His brain was completely broken, and he thought he was protecting me, but I left that visit with bruises on me, and it was absolutely devastating. It was a really high price to pay for me personally, but it got him admitted. This was the first of what would be 4 hospitalizations that year, and the first few were for delusion and psychosis. He had lost all touch with reality. He thought people that were there to help him were really there to hurt him. It was so, so sad. And this is when I learned that insurance companies generally limit hospital stays to 3 days and then reevaluate. So for the next few weeks, he was evaluated and kept. But then the day before Thanksgiving, though he was still very delusional, this hospital chose to release him. I still hadn't been alone in a room with him since that first event, and I refused to pick him up, so they sent him to his sister's house. At her house, his behavior continued to be very bizarre. And when he showed up for his day program at a different hospital 2 days later, they admitted him right away. The provider asked me, why was he released from that other hospital? We can't in good conscience release him right now. So they admitted him. They did this before insurance even gave approval. They took him in, and he was eventually released from there with much clearer thoughts. And this was a great example of a hospital that cared well for him, that had his best interests in mind before even considering payment. And insurance did end up paying for that stay, but I'll never forget that they took him before knowing that. Once his thoughts cleared, he fell into a really deep long-term depression. And he was hospitalized twice for that. And though his last hospitalization was a year after the episode that got him taken from our home, his depression lasted for another 3 years after that. So he got out of the hospital, and he spent after the fourth hospitalization, and then he spent another 3 years in extreme depression. And it was a long journey.
Thank you, Becky. It does seem like there were highs and lows along the way, but that you did meet caring people who were able to help. And that is one caregiver's story, but let's look at the role of the caregiver more broadly. The role of the caregiver can be summarized as this: to fill in where our loved ones need help. When a person is dealing with a mood disorder, it is likely having certain impacts on their thoughts and behaviors. For example, with depression, a person can experience cognitive impairment or issues with their thinking. It can affect areas such as reasoning, organization, attention, and memory, which we in our office refer to as ROAM, and you can check out on our website at familyaware.org/more-than-mood. A person with bipolar disorder often will have a lack of insight into their having a mental health disorder and into the impact that their behaviors are having on their families and their work. So these are impediments to accomplishing the kinds of tasks that one might ordinarily be able to accomplish. So considering your loved one's functionality at this time when decisions need to be made, whether it's in choosing a plan or making an appeal, what can you realistically expect? Then you look at that and you say, well, how can I help? You will know the kinds of things that actually need to get done, and then you can work with your loved one to ensure that they do get done. Another thing to do is to prepare yourself for the long haul. It might be that their mood disorder is episodic, so that this is something that will last a certain period and then not be an issue for a while and then come again. And it may be that their mental health issue is something that is treated and then well maintained. So just know that all the things that you're doing now are really important, and there may come a time that you need to do them again. Another thing that's important to have reasonable expectations about is what kinds of financial demands are going to be made. Your loved one may need financial support. And here, for example, if we're talking about someone who has an adult child who has a mood disorder, it may be that they have trouble finding or keeping a job, and it may be that they have cash flow issues. But think about what kind of support your loved one might need, and also what kind of support you're willing to give, and then how can you prepare for that? Let's hear a little bit more from Becky on some of the challenges that she faced as a caregiver.
When I think of costs, I think treatment is really expensive and costly. And I'm a really organized person by nature, but trying to track the expenses that were piling up for his multiple hospitalizations and day programs and providers was really overwhelming. He wasn't working at all, which that seems like a funny statement. He wasn't functioning at all. He wasn't getting off the couch, so he certainly wasn't working. And meanwhile, bills were piling up. Ambulance bills weren't covered. Co-pays weren't covered. One of his medicines cost $50 a month, and he was on multiple medications at that time. the psychiatrist we decided on doesn't take our insurance, so we pay out of pocket. And it was really disheartening at times, but it was also life or death. And, what's money for if it's not to spend it up trying to save the lives of those we love? So costly, but worth it, yes.
Thank you, Becky. Here are some concrete ways that you might be called upon to help your loved ones. You might need to fill out forms or research a health plan. You might need to make calls and make appointments. You might need to help them get to appointments. You may need to manage finances in a way that you didn't before. You may also need to gather information for appeals and make sure that you're meeting deadlines. But also remember that you can set limits. These are important issues to be sure, but you may not be able to get it all done. And that is where you having a support network is extremely helpful. Maybe someone can take care of the kids while you put together the paperwork, or maybe someone else can drive your loved one to an appointment so that you pay bills. Whatever the circumstances may be, just know you're not alone. And you also need to make sure that you are taking steps to protect your own wellness. And we will talk about that a good bit later. Let's take a few minutes to cover insurance basics. This is not exhaustive. This is not, everything you need to know about health insurance, but we just want to make sure that as we move forward, people have an understanding of these general concepts and these particular terms. Health insurance in the US was so significantly changed by the Affordable Care Act that there are a number of critical points that came from that legislation. We're going to focus on the ones that seem most appropriate for you to know as you are moving forward in choosing a health plan and getting a sense of what your options are. Number one is that mental health care must be covered. It is one of the 10 essential health benefits. If you are looking at a health plan that does not have mental health care included, then you are not looking at a plan that is compliant with the Affordable Care Act. A really important part of the Affordable Care Act was that it eliminated consideration of pre-existing conditions for insurance eligibility or charge. So if you or your loved one had a previous diagnosis or treatment for some medical or mental health condition, that cannot be a factor in the insurance company's decision about whether to offer you a plan or what they're charging for that plan. There is, in every case, a limit on out-of-pocket spending by the individual or family that is insured. It is made clear ahead of time, and it is an absolute limit on what you could be called upon to spend in any given year from your own resources. Now, it does not include premiums, but we'll get to that in a moment. However, I do want to mention that that limit on spending does not apply to the health insurance company. They are not allowed to impose annual or lifetime limits on coverage. This is particularly important in mental health when there used to be a limit of a certain number of days that would be covered in inpatient hospitalization over the course of a person's lifetime. And one other thing that's important is that young adults can stay on their parents' insurance until they reach the age of 26. As you may know, the early 20s is a time when mental health conditions often manifest, or they become more clear about what particular condition they are. And so having the option, if the parents are willing and able, having the option to stay on their insurance means that a young person can better get their footing and get the care that they need in order to get their mental health in a place where they will hopefully be able to move forward with maintaining as opposed to putting off treatment and having it get worse. There are three broad categories of how healthcare expenses are paid for. One is private insurance, and that is insurance that you acquire through the marketplace or through your employer. Those are the two big categories. There's public insurance that includes Medicare for people who are elderly or long-term disabled or have certain health conditions, and there's Medicaid, which is for people of low income. And then there's self-funded, which is that you're paying out of your own pocket or you're paying for someone else. And it is either that you don't have insurance or your insurance does not cover that particular provider and you can't get them to do it. So those are the three big buckets of how payments are made. All right, let's just cover a few payment definitions. We're going to talk about premium, deductible, co-payment, co-insurance, and the out-of-pocket limit. The deductible, co-payment, co-insurance, and out-of-pocket limit have to do with cost sharing, which is, despite the fact that your insurance covers your healthcare costs, there's a certain amount that you need to pay first out of pocket before the insurance kicks in with their payments. The premium is the amount that you pay for your health insurance, and it's usually paid monthly. It could be paid directly to the health insurance company. It could be paid through the marketplace. It could be paid to a health plan administrator, or if you receive your health insurance through your employer, it is generally paid through payroll deduction. The deductible is the amount that you'll pay for your covered health care services before your insurance plan starts to pay. A copayment is a set amount that you'll pay for covered services or for medications after you've met your deductible up to the out-of-pocket limit. So for example, it may be that a trip to the primary care provider for a sick visit would be $30 and a trip to a specialist could be $50. Things like that would be copayments. Instead of copayments, sometimes or some services require coinsurance payments. And instead of being a set amount, it's a percentage that you pay for those coverage services in between the point where you've paid for all of your services up to your deductible limit and when you reach your out-of-pocket limit. The out-of-pocket limit is the most that you'll be required to pay in a plan year from your own pocket. So after you reach that limit, then the insurance company needs to pay for all of the covered services. Very often, if you are a family that has typical medical expenses and nothing extraordinary happening, then you may not reach your out-of-pocket limit. But it's good to know that there is some kind of cap on what you'll be required to pay, and it will help you determine what you can afford and what kind of plan you'll want to choose. Sometimes the amount of the deductible is the same as the out-of-pocket limit. Often it is not. But let me just give you an example. Say for my health insurance plan, we have a $2,000 per individual deductible, $4,000 per family, and then a $4,000 per individual out-of-pocket maximum and an $8,000 family out-of-pocket maximum. So if, for example, I had a bunch of healthcare services that I needed, then when I reached the $2,000 out of our pocket, then my expenses would be paid except for the copay and coinsurance. But once my entire family reached the $4,000, then all of our care would fall into the area between the deductible and the out-of-pocket limit. Once we had reached the out-of-pocket limit, then the burden goes over to the health insurance company to pay. When I talk about a provider, what I'm really talking about is a healthcare professional who's delivering services. We talk about primary care providers, which is your physician or your nurse practitioner or whoever it is that you see for your regular checkups and that kind of care. It could be a pediatrician as well. When we talk about someone being in network, it's that the provider has a contract with the insurance company that they'll participate in this plan. They will see the individuals who are, and families who are members of this plan, and they agree to charge certain fees. An out-of-network provider is someone who hasn't made that kind of arrangement with the insurance plan. And so they may not be covered at all under your insurance plan, or they may be covered at a different rate. It depends. And one of the big things that it depends on is whether you are participating in a health maintenance organization known as an HMO, or a preferred provider organization known as a PPO. HMOs work to control costs by controlling the network. And so the care is coordinated through the primary care provider. The network is more restrictive. You're generally limited to in-network providers. You need a referral from your primary care provider for almost all your specialists you would go to. But there are lower out-of-pocket expenses for care than usually in a PPO, and the premiums are generally lower than with a PPO. With a preferred provider organization, you are the captain of your own ship, so to speak. You're coordinating your own care. You don't require a referral to go see a specialist, and you choose your specialist. There may be a difference between what you'll pay if you go to someone who is in the network and someone who is out of the network, but you have the flexibility to see basically any healthcare professional. If you see someone in network, you'll have likely a higher level of coverage and lower costs than if you saw someone who was out of network, and the premiums generally will be higher. One of the things that affects what you pay is also the rules that insurance companies put into place, which are to contain their own costs for the most part. One tactic that is used is called prior authorization, which requires that the plan approves a service or a medication in advance. When you are shopping for your health insurance, you'll be able to see whether prior authorization is required for example, a particular medication. If you want to know whether prior authorization is required under your plan, you can check your documents, but you can also call the member service number. Whenever you make a call, please keep detailed notes. What number did you call? When did you call? Who did you speak with? What was said for and by whom? And ask the service representative, what is the case number, or what is the referral number that they have, the reference number that they have for your call with them. And just keep that so that if a question ever comes up, you'll have that information to provide. In a prior authorization, your loved one's provider is their advocate. They are the ones who are making the case to the insurance company that your loved one needs this particular treatment and or these particular services. And so the provider or their office files the forms and communicates with the insurance company. There may be circumstances where it's appropriate to seek expedited approval. Those generally have to be turned around in 2 to 3 days. And it may also be that if things are going to be held up for a while, then there may be a way to get coverage of something else that will serve for a short period of time during the authorization process. Another way that insurance companies try to control costs is through step therapy, which is applied to medications. And it's when a health plan requires an insured person to try less expensive drugs before they authorize use and payment for more expensive drugs. So the explanation is that this ensures that you get the safest, most effective, and most reasonably priced drug available. And that is what insurers say. But other people call it fail first. And in some ways, it can put people through a lot of difficult times before they're able to get to a medication that is effective for them. What step therapy requires is that a person take a generic or low-priced medication for a full trial of that and not have the results that are expected or appropriate, and then try the next one before they can get to whichever level the insurance company requires for you to get to the medication that is expensive for them. As we go forward, you'll hear a couple of other definitions, and just when Wells speaks, he'll be talking about consumers, and what he's talking about is an individual who is utilizing medical or mental health services. And also you'll hear talk about behavioral health care, which is a larger category than mental health care. It includes services and treatments for addressing mental health conditions and substance use disorders. Now let's move to our next little bubble about choosing a plan. One of the first things that you're going to do is to know where you can get good information so that you can make an informed decision. We recommend that you go to government sites such as healthcare.gov for the federal marketplace, or your state marketplace site, which should also have information. Government sites are required to provide full information on all of the Affordable Care Act plans that are available to you in your area. They are not allowed to offer plans that do not comply with the Affordable Care Act. And they also have to accurately determine eligibility for subsidies. I can't say the same for non-marketplace sites. They may not offer the same information so that you're not able to compare one plan to another in a reasonable way. They may not offer the full range of plans, and they may offer plans that do or don't comply with the Affordable Care Act. If, for example, there's a plan that is being offered to you that does not provide the 10 essential health benefits, then you know it's not an Affordable Care Act compliant plan. And you just have to think about, when you go to these sites, what is it that they're trying to get from you? Chances are they're trying to get you to sign up for a plan through them. But if you're going to a news source or a financial advice website, then they're not asking you to buy a plan from them. So you can read that information and you can assume that it will generally be reliable if it's from a reliable source. For example, I recently read an article through the New York Times, and that was very clear about some things about health insurance. I listened to something on The Motley Fool, and there too, it was very helpful. It was very clear. Just make sure that you're going to a site where you can get reliable information. When you're enrolling for a plan through the federal marketplace, there are a number of ways that you can do this. Some you can involve an agent or a broker or an assister, which they can either contact you if you request it, or you can contact them. You can use a certified enrollment partner's website. You can apply online at healthcare.gov. You can enroll by phone through the marketplace, and you can also complete a paper application and send that in. The benefit of talking to someone is that they will be able to tell you what premium is required, when it needs to be paid, answer your questions, things like that. But many, many people apply online and do just fine. And it just depends on how comfortable you are with the process. When you pay your premium, you will generally do it through an online portal. However, you can also pay by check. Just choose an option that's convenient for you. I am now going to turn this part of the program over to Hannah Frigand, who is the Director of Education and Enrollment Services at Healthcare for All. Healthcare for All is a nonprofit organization based in Boston that works to ensure that everyone in Massachusetts has the equitable, affordable, and comprehensive care that they need to be healthy. Hannah started working at Healthcare for All as an intern in 2006 and later joined the Healthcare for All team as a helpline counselor. She's now in the position where she manages the day-to-day operations of the helpline. I thank you so much for being here, Hannah, and I turn it over to you.
All right. So I'm going to discuss some best practices for shopping for health coverage through the marketplace. So it can be an overwhelming process when you first log into the marketplace to compare plans side by side. So there's certain things that I recommend considering when you look at the different plan options. So there's a variety of ways of filtering plans out to make the best choice for you and your family. So sometimes people have preferences for what insurance carriers that you work with. There's choosing ones that are in your price point for the monthly premium cost. There's making sure the insurance network has your providers. I'm going to talk a little bit more about all of these different things and how to go through the marketplace and find what you're looking for. If you're shopping for health insurance and you are already know the specific doctors that you want to have in network, that's probably the best way to start, because that's a good way of filtering down the insurance options. So if there's primary care specialist, behavioral health specialist, that's a good way for you to whittle down an overwhelming number of plans. And from there, you can look at what the monthly premiums will be, which is just one aspect of the cost sharing that you would face when using your plan. When you're looking for through the provider networks of plans online, I always recommend contacting the doctor's office before making a final determination, because provider directories change. Sometimes they're not updated in real time, and it's really important to double check with the doctor's office. Sometimes doctor's offices will have what they call closed panels, and that means that they might not be accepting new patients for different insurers at that time, and that changes regularly. So it's really important to contact offices if you want to make sure you'll be able to continue to see them. So there's shopping guides available online that can help you map this out. You can use it like a worksheet to work through what you expect usually to be using for medical services, what might be realistic expectations for services that you may use but not regularly. So you want to look at like inpatient hospitalizations or other specialty services that may happen once in a while but not regularly. So these are really important to consider, in particular for behavioral health, because it can be very complicated to make sure that you have both a plan that's going to meet your network needs and the cost. When applying for health insurance, it's a good opportunity to check if you can qualify for subsidies. You might be surprised that the income level for a family of 4 is $100,000 a year to qualify to get tax credits to lower the monthly cost of health insurance. So I would advise you to check to see if your family might be able to get assistance through advanced premium tax credits through the marketplace. Advanced premium tax credits can lower the monthly premium, and it's just important to make sure that you are filing taxes with that information, because you will need to do what's called reconciling at the end of the year. When you reconcile, you are using the amount of tax credits that you received for assistance and matching that to what your income ends up being for the tax year. So you want to be conservative and make sure that they're going to be relatively close so that you're not responsible for paying back any of the tax credits. You can also get cost sharing reductions, which help with lowering the copays and deductibles in addition to advanced premium tax credits. That's to a lower income threshold, but that is another opportunity to lower your out-of-pocket costs. So you can get this information by applying through the marketplace and seeing if you would qualify and enrollment assisters can assist you with that. One thing that's important is there isn't one plan that's going to be right for everyone, and there isn't going to be a perfect plan. It's going to be give and take, making sure that you're choosing a plan that you can afford to pay the premiums for and the cost sharing, and that have enough of the providers and coverage that will meet your needs. We know that this can be an overwhelming process, and just take a breath and know that there's assisters out there that can help you. Just make sure that you take your time to do your homework and choose a plan that you will feel comfortable taking. But help is out there, so if you're feeling overwhelmed, you can reach out to enrollment assisters to assist you and make a good decision together.
Thank you so much, Hannah. I really want to underscore something that Hannah said. There is no perfect plan, so just try to find an insurance plan that meets your family's needs the best you can, considering access to providers, medication costs, premium affordability, and cost-sharing expenses. And if it doesn't work out to be the best for your family, you can change it next year. Now, so you can get a better sense of what Hannah was talking about, I'm going to show you what you can expect to find and what you should look for as you go through the marketplace. I've taken screenshots that will be similar to what you'll see as you're shopping for a plan. And although it's not the most exciting thing I've ever talked about, we decided it's better for you to have a good sense of what you'll see than to talk about it without showing. Feel free to pause and come back to any part you want to see again. And also know that as you're doing your shopping, you can bookmark pages in your browser, you can use your browser history to find pages you visited before, and you can also open a spreadsheet so you can keep track of links to different options that you've come across. Here we go. When I went onto the marketplace and I put in my fictitious family and where we lived, it came up with 25 plans that were available to cover me for our family. And the first screen that you see gives very summary information. Here, for example, I'm looking in Illinois, and the one on top is the Blue Cross and Blue Shield of Illinois Blue Focus Care Bronze 209. And just remember also, these are 2019 plans. This is not a 2020 plan, and I'm not saying that any particular insurer is the right one for you. Also, you don't need to read what I've put up because it's just to give you a sense of what it looks like rather than the content of it. So let's just assume that this first plan is of potential interest to me. I see on the left-hand side that I can press a link for a quick view. So let's press the link, and this is the screen that comes up. Again, it's not a whole ton of information. There's nothing that's going to make me love it or hate it. I want to get some more information. So I'm going to click where it says Summary of Benefits. And then it takes me to the Summary of Benefits, which is a fantastic thing that is required by the Affordable Care Act. And what it means is that you will be able to compare side by side different plans in a way that they match up. So each particular category has to be listed. Certain costs need to be disclosed, and any restrictions also need to be disclosed. Here in particular, we want to look at services related to mental health. So I found this part that says if you need mental health, behavioral health, or substance abuse services, then they list outpatient services and inpatient services. You see that for someone who is a participating provider, you pay 50% of office visits, 40% co-insurance for other outpatient services. And if you don't go to a participating provider, the service is not covered. Also, you're required to get a referral. And then I also put in the part about if you need drugs. This is just to give you a sense of what you'll find in terms of cost and coverage in a way that you can compare one plan to another. I have found that when I have done this exercise for my own family, I end up printing out a few of these summaries of benefits and laying them out on a table and getting a sense of where things line up for what my family might need. Okay, so let's assume that this is of interest to me, this particular plan, but I still have some questions. So what I'm going to do is go and look at the plan or policy document. So I click on the link at the bottom, and it takes me to a website that's got a whole lot of information. The plan is going to tell you everything that it covers, what its exclusions are, and all of that. And if there is a particular medical condition or mental health condition of relevance to your family, then I'd suggest that you look for it and see whether there are any exclusions, what's covered, what's in, whether you have to go to certain places, what kinds of approvals are required. But for the sake of our looking at it, let's just look at some things about mental health. So outpatient office visits, here it's 50% of the provider's charge. Inpatient treatment of mental illness. Well, wait a minute, what do they mean by mental illness? Does that include my loved one? So you can look through and find the definition of mental illness. You can also look at the plan for what the hospital benefits are in case there's a possibility or likelihood of inpatient care needed. Here, for example, the covered services, number of inpatient days, there's no limits, but they also cover partial hospitalization. They also cover intensive outpatient treatment, but you would want to read the fine print to make sure that it's going to cover the things that you want to be covered. And then here's an important thing, hospital limits. Here you see that there's this thing called pre-admission certification, which is basically another kind of prior approval. And there's also concurrent review, that once someone is receiving care in the hospital, then the plan is going to be reviewing that to make sure that it's still what they would call medically appropriate. You may recall from Becky's story that Joe was discharged from the first hospital after just 3 days, and it was because insurance wasn't paying for it anymore. Presumably, they had some level of review that said, or some assumption that 3 days was enough for that particular care, and either the hospital did not seek to have that reviewed and extended, or it was reviewed and denied. We don't know. But just know that these processes happen, and the fate of your loved one could be dependent on that. It also would help you know so that you know what kinds of advocacy you might want to do. For example, if your loved one was in the hospital and you knew that it was only a 3-day stay, but you believed it needed to be longer, then you'd probably want to seek out the hospital social worker and talk with them and get their support for extending your loved one's stay so that they could receive appropriate care. Another area you might want to look at, especially for people with mental health conditions, but basically people with any kinds of chronic conditions, is to look at the prescription plan. Every plan has what's called a drug list or a formulary. It lists all of the drugs that are covered and also what the copayment is expected to be on it. As you get past the generics, the price generally goes up of your copay or your coinsurance. So you would want to look up the kinds of medications that you know you'll be taking, or your loved one, anyone in your family and on your plan will be taking, and see at what level those are covered. And then finally, you'll also want to look at the limits for the prescriptions. And here you see that it requires prior authorization for certain medications. And also you need to have step therapy, so that you need to, as I said earlier, try the lower priced generic medications first, and then at some point they will review your request or your provider's request that you take a certain medication. All right, so that should give you a sense of the kinds of things to look for, where you can look for information, and what kind of information you can expect to get. Now, similar things apply when you're changing plans, but I do want to also raise a couple of things. One is that you really want to avoid having a gap in coverage. So try to get everything lined up before your current plan expires. Also, you may be shut out of getting a plan if you don't act within open enrollment. So we also don't want this to result in a setback in treatment. For example, one of our volunteers knew she was losing her job and then also her health insurance. And so in order to plan ahead, she coordinated with her provider so that she got a 90-day supply of her medications so that she would not have an interruption in her treatment as she got on new health insurance, as whatever authorizations needed to happen went through the process. So just think ahead, and what can you do so that your loved one does not suffer as you change. All right, now we'll assume that we have a plan, and we want to talk about how to make the most of it. And for that, we're going to turn to Wells Wilkinson, senior staff attorney at Health Law Advocates in Boston. It's a nonprofit public interest law firm that provides free legal representation to help low-income residents in Massachusetts access healthcare coverage or services. Wells represents clients seeking commercial insurance coverage for needed care, and he has successfully appealed denials of a wide range of treatments, from expensive pharmaceuticals to ABA therapy for autism. Wells also advocates for stronger mental health parity rights and access to needed behavioral health services. Wells, I'm thrilled that you're here. I know you have a ton of experience and expertise, and we are very fortunate to have you with us.
Okay, my pleasure, Susan. Thank you. So I would like to talk today about consumers' rights under their health plans and how they can use them to make the most of their health plan coverage. It's important for consumers to know where to find their rights and to know how to assert them effectively if they ever face a denial of coverage from their health plan. The first source of these rights is the health plan contract, which is usually about a 100-page long document. It can be called a benefit handbook or certificate of coverage or an evidence of coverage. It's this long document that lists all the services that are covered and all the services or treatments that may be excluded under the plan. And if you get a denial, you should always review your benefit handbook to see what it says about that specific service and whether it's covered or excluded. The next source of important rights for health plans is actually either state or federal law. Some plans are subject to both state and federal law and all the guarantees that they have to require health plans to cover certain medical treatments or services, and other plans are only subject to federal law. And even if your benefit handbook says something that is not covered, if it conflicts with either state or federal law that apply, then the law trumps. So I'd like to say a few words about consumers using the appeal process. I work with clients every day to help them do this, and we found the most efficient and most effective way to challenge a health plan denial. But to be successful, you really need to do three things. First, you should read every denial notice from the plan carefully and make sure you pursue all of your appeals until the end. Even if you simply resubmit the same information each time, it's important to know that each level of the appeal process is decided by different people. And many people, because of this, win their appeals kind of later on, even if they're denied initially. In fact, the last step of the appeal process is called an external review appeal. And it is often the fairest opportunity because it's decided by a medical professional who is not an employee of the health plan. The second piece of important advice about the appeal process is to not miss any deadlines during each step in the appeal process. Each denial letter should very clearly state the deadline for the next step in the process. If the letters are confusing or misleading about the deadlines in any way, my first advice would be to call the plan's appeals department and see if you can get a clear answer from them. If issues remain, you can also resort to calling either the State Division of Insurance or the U.S. Department of Labor to ask them for assistance understanding if you have a deadline or what the deadline would be. And the third thing to remember, is probably the most important, is that These appeals are very often decided based on medical information that you submit in support of your appeal. Even if you file your appeal by phone with the plan, which you're allowed to do, you always have the right to follow up that phone call and that appeal request with the prompt submission of your medical records, and or a letter from your treating provider that explains why the treatment or service is necessary for you. You should definitely include medical records and letters of support from your providers with every appeal, and you should never assume that the plan has any information from your client's providers. I always submit what I think is important, and I resubmit it at every level of the appeal because I just don't trust the health plans to make sure they include that information internally. And if I get any new information, like a new letter from a provider or some new medical records, you always have the right to add that additional information at the next level of the appeal process. So the first step of asserting your rights under your health plan is to understand when you're facing a denial. A denial can be any decision by the health plan that refuses to cover a certain treatment or that results in you having to pay for treatment, such as a decision around your cost sharing or your deductible. The health plans must all provide written documentation of their decisions about coverage. And oftentimes these take the form of the letters that you receive that are called an explanation of benefits, or EOB. This is the letter you receive from the health plan that typically says the words, "This is not a bill." And if you read through that document, which we advise our clients to do, all the time, it will actually provide a reason for any instance when the plan has decided not to cover a particular treatment or service. And you have to read that closely to see what that reason is. More importantly, when you receive this explanation of benefits, that starts the clock on your first deadline to file an appeal. You have 180 days from the day you receive any notice from your health plan that denies coverage for a service to file your first level of appeal. And if you miss that deadline, unfortunately, then you can lose all your access to the appeal process afterwards. So next I'd like to talk about what a patient or a caregiver can do if someone needs a certain treatment and a provider that they want is not covered under their plan. The first kind of general rule of most HMO or health maintenance organization style health plans is that you're only covered when you use their in-network providers. But you can get an exception and you can get approval to see an out-of-network provider when you can show that there's no adequate in-network provider that's available to you. Now, some private health plans have this as a right under state law, but almost all health plans have this as a right under the benefit contract itself, if they have a limited network of providers. So regardless of where you get this right, the most important thing you need to know is that you need to document how you've shown that there are no available in-network providers. So the best way to do this is usually by contacting the plan, asking them for assistance identifying any available in-network providers, and then as you contact these providers to see if they're available to take you as a patient and they're qualified to treat the condition that you seek treatment for, keeping very detailed notes about each one of those phone calls to show or how you can rule each one of these providers out, either because they made you wait too long or they just weren't able to provide the specialized treatment that you need. One example I'd like to share from one of my clients. I had a 7-year-old client with a complex mental health diagnosis, and his mother wanted to get the plan to cover a play therapy group that specialized for kids of his age. And we were successful with his appeal to get the plan to cover this treatment, in part because we worked all the way through all the steps of the appeal process and got to our external review. And we also could show from his medical records that he had tried a traditional talk therapy treatment for almost a year, but this treatment had not addressed his needs. And so the play therapy group was much more appropriate given his age. So if you face a denial where the plan has said that the treatment that you want is not covered under the plan, The first thing consumers should do is check their benefit handbook and be sure that's the case, and make sure that the benefit handbook kind of clearly states that that particular treatment is not covered or is excluded under the coverage terms of the plan. If the plan is saying that something's not covered because it's experimental or it's investigational, those kinds of denials can be appealed. And the most important step for that kind of appeal is almost always the last step, called an external review. And again, here you want to make sure you submit information in support of your appeal, and it probably would be a good idea to work with your providers to try to get any scientific information that they can help you find to show that that particular treatment is effective and there's a scientific basis to warrant trying that treatment for your condition. So I would also like to point out one important detail about consumer appeal rights under state and federal law. If the consumer is in an ongoing course of treatment, so for instance, they're in weekly mental health therapy or they're taking a prescription drug, if the health plan decides through some kind of concurrent review process to attempt to end coverage for that treatment, and the treatment's been approved previously and it's ongoing, then consumers have this very important right to require the health plan to continue covering the treatment while their internal appeal is pending. And so this can, for many consumers, lead to at least another month of treatment, but more importantly, it can also guarantee that their treatment isn't interrupted while they're starting the appeal process. And one aspect of this that's also important is that even if the consumer ultimately loses their appeal, they're not at financial risk. The plan has to cover the treatment that was ongoing and provided during their appeal, even if they lose. For example, if a patient were admitted to a hospital for inpatient treatment, and after a few days, the health plan had decided they did not want to cover any further treatment, patients can appeal that kind of denial as well and ask for ongoing coverage pending their appeal. And if they're in a situation where they're at imminent risk of serious harm to themselves or others, if treatment is ended, they can also ask for ongoing coverage pending their external review appeal as well. So again, it's important to make sure you pursue all of your steps of your appeal, and also to work with your providers to request this ongoing coverage during the appeal process. And one final consumer right I'd like to mention is the consumer's rights under state or federal mental health parity laws, which require health plans to provide access to behavioral health benefits in a manner that's no more restrictive or limited than access to medical and surgical benefits under the plan. If you're facing a denial for behavioral health services or just administrative barriers to accessing behavioral health services, you should certainly raise mental health parity concerns with the plan, and also, if necessary, file a complaint with the applicable state division of insurance or the U.S. Department of Labor. Unfortunately, the timeline for resolving a complaint around parity can be very long. It can be an average of a year for the Department of Labor, for instance. So it won't be something that will give you a quick answer or response, unfortunately. But we think it's important to file these complaints so that over time, regulators pay closer attention to the health plans and any barriers they're imposing to access to behavioral health services. One of the most challenging aspects of pursuing your rights under the insurance appeal process is the time it takes, because each step of the process can leave you waiting 30 days or 45 days for an answer to that level of appeal. And it's really important just to remember to stick with the appeal process and follow it through. We also work sometimes with providers who've been through a couple of levels of appeal on their own on behalf of their patients, and they can also feel exhaustion from this process as well. But again, we just try to remind them that Sometimes the most important step of the appeal process is the last step, the external review. So you have to stick with it and make sure you follow all the way through to the end. We've had so much success with the appeal process. We win, these cases for more than 3/4 of all of our clients when we find they have any kind of legal basis at all to challenge a denial. So it's very important to follow this through as much as you can.
Thank you, Wells. Now I'm going to try and just highlight a few things. Overall, about 50% of appeals are decided in favor of the consumer or the insured individual or family. Wells said that for his office, it's about 75%, which is great. But even 50%, the odds are pretty good, especially when you consider that often people do not take their appeals to the last appeal possibility, and they just accept that it's been denied. And as Wells said, it makes sense to just keep going until you exhaust all of your appeals possibilities. Here's a couple of things to highlight. Document everything, as we discussed. You want to document all of your calls and correspondence, and you want to keep all of your bills and notices. It helps a lot to keep your loved one's medical records current so that you don't have to scramble around and get bits of information as you're preparing to file an appeal. And you can also request that the insurer provide all of the records and notes related to their decision-making in this particular issue. And finally, ask for your loved one's provider to support you all in making this appeal, because they were the ones who thought that the treatment was a good idea and prescribed it, and they should be advocating for that particular treatment to be provided. As Wells pointed out, you have the right to continued coverage and continuing treatment while your appeal is going forward. That's the legal right. But for the caregiver, it's just important that you continue to advocate for your loved one. You want to make sure that they're getting the care that meets their needs, and you don't want the appeals process to be something that causes them to backslide in their wellness efforts. So work with the provider to get the care that's best for your loved one. And if that one's not immediately available, what's a reasonable and hopefully temporary substitute? There are consumer assistance programs and similar agencies across the nation that can provide you with support for exercising your rights. Healthful Advocates is here in Massachusetts, but all over the country, there are programs that are available. In addition, if you are covered by a job-based health plan, you can contact the Employee Benefit Security Administration, which is part of the U.S. Department of Labor, and I've provided the URL and the phone number there. All right, let's move to the self-care bubble and just emphasize a few things. One is that, as you probably know, taking care of yourself is incredibly important. You cannot be giving others all that you want if you're not taking care of yourself. So just remember to find balance. Giving of yourself needs to be balanced with giving to yourself. And so if you're thinking, I just don't have time for that, you really don't have time not to do that, because you're not going to be there for the people that you care about if you're not taking care of yourself. One thing that we in our office like to use is this self-care wheel, which reminds us that we have several dimensions to our well-being: psychological, emotional, spiritual, personal, professional, and physical. And the wheel lists different kinds of things that can benefit you in those particular areas. And just remind yourself that there is a balance, that you can't just focus on your physical well-being. You also need to nourish your spirit. You can't just focus on your professional success. You also need to look at other aspects of yourself and make sure that your emotional well-being is addressed. So please download this self-care wheel and use it to prompt you to engage in activities that address your entire well-being. I would also urge you to check out our coping with stress webinars that we have available on our website. Visit familyware.org/trainings, and there you'll find many, many different strategies for coping with stress. There's one that emphasizes stress in the workplace. There's another that emphasizes mindfulness as a form of stress reduction and stress management. Now, let's just check back in with Becky about what she did for taking care of herself.
It was very difficult to stay well and maintain my wellness during this time. But how did I do it? Right away, I found a great therapist that was critical to helping me sort of figure out my own feelings as well as figure out the mental health system. I had no idea how to navigate it, and I would come to her and say, this is happening, or the hospital's releasing him, or these insurance payments are so much, and she would validate that was true, and I wasn't doing anything wrong. It was just true. So it was really difficult for a long time. I didn't feel good for a long time, but I fortunately was able to function and get my husband some help. I remember during that time, the first feeling that I felt every morning when I woke up was dread. There was nothing for me to look forward to in a day. I knew how hard the day ahead of me was going to be based on how hard the days behind me had been. And the thought was, even if he got better that day, so much damage had been done to everything, to our relationship, to him, to me, that it just didn't seem like there was ever going to be a reason to be happy again. Yet we kept going. And, people along the way would say to me during this time, you look awful. You look really tired. And which is a lovely thing to say to someone going through hard things, but we do it all the time, don't we? But really, I'd say, I look awful because this is awful, and I feel awful, and this is really hard. And so, I guess I just went through a couple of years feeling and looking kind of awful. And one of the things that, it's going to sound a little weird, but I had this thought early on, like during the first few months, and it was, what if someone told me that it would take 3 years of going through life this hard, and then I could have my husband back? Could I wait it out? Would I make it? And for some reason, that number stuck in my head. Let me give this 3 years of giving it all I can give and see what happens. And, so when you take away the needing to have things resolved in the next 2 weeks, you give yourself some freedom that this is going to take a while. It did free me up a little bit. And it really helped me get through, because as you're caring for a spouse, you're not getting anything in return. You're often not getting a hello or a good job or any validation, but you keep going. And, ironically, it took 4 years for him to get well, but having that thought that it was going to take a couple years helped me keep going initially. Another one of my saving graces, honestly, was that I was an avid Zumba girl, and I took 3 or 4, maybe 5 classes a week during that time. So I was around positive, strong women. When all this happened, I missed a few classes, but I pretty consistently went to class still, and it was a welcome relief, a great way to get out of my overworked brain and to laugh and to be around just other people in life, doing something that was good for me. So it sounds little, but it was huge to me. It still is. Another way that I survived was I built a life around him and without him, which sounds terrible because in our marriage, we'd spent all these years together, moving closer together. And here, to survive, I had to separate mentally a little bit from him. So I would drag myself out to visit friends and I say drag because it's really hard to go out and try to have fun when your whole world is imploding, but I would try to say yes to invitations. I would go alone. He wouldn't go anywhere. We always had been 2 peas in a pod, but I developed interests very separate from him. I didn't tell him anything about my life for years, and honestly, he didn't ask. He couldn't care. He's a great guy, but he could not care. And I can't say it wasn't upsetting at times. I know, logically, he was the one that was on the front lines, dealing with this illness, fighting for his life every day. He was on the front lines, but in many ways, I took a hit too. I definitely took the hit financially, and we'd never had a lot of resources like a lot of people, we're just average income people. But when he was sick, I gave up a lot to cover everything that he needed. And there were absolutely years where I would think, I just need to get away. I need a vacation. I need like just time to get away from all of this. And you know what? I couldn't because we didn't have the money. And yes, I could charge it, but I'm the one getting the bill next month, and that caused more stress for me. So, you know, that was tricky. I wasn't bitter, but I wasn't happy at how limited our lives were during that time. And so, you know, one of the stories that kind of makes me laugh is that after one of his hospitalizations early on, you know, I was kind of getting used to it. And so I spent the 8 hours or whatever it is in the emergency room, taking care of him, getting him admitted, exhausted. I texted our group of people that needed to know he'd been admitted again in the hospital, shut my phone off, and I went to the shoe store and I bought myself these wonderful maroon boots. And I thought to myself, you know what? Anytime he goes into the hospital, I'm getting new boots. And it sounds funny, but it was a little moment of self-care for me, and I did end up with several new pairs of boots that year. But it was sort of a learning to, no matter what happens, no matter how bad this is, you can take care of him, but you need to take care of you too. So that is another means of self-care that was really personal to me.
Thank you so much, Becky. I'm not sure that new boots would be something that I would have thought of, but it sounds like it worked out really well for you. And I know that people can be inspired by that, not to get new boots necessarily, but to find the things that can make them recognize that they need attention too, that they need something good for themselves, even in the midst of all that is going on. But let's look at just a few things to consider that you might do. Setting boundaries and maintaining them is something that can help you avoid frustration and anger and make you feel good about yourself. So whether that's that you're setting financial limits, that you are carving out time for yourself that you will not allow to be interrupted, whatever your areas of boundaries, and certainly there are several areas that would be applicable all at once, be firm. Be clear, be consistent, be kind, but respect yourself and know that you have set those boundaries for a reason, and that reason is your own well-being. It's perfectly reasonable to acknowledge your worry and to accept it, but also find ways to manage it. Practice self-care in whatever way or ways are workable for you, and lean on your support network, whether that's someone who can step in and do some of your day-to-day tasks, whether that's someone removing you from your situation for a while and getting your mind off it and being able to focus on something else. Just make sure that you surround yourself with people who are there for you in whatever ways you require. All right, let me just take a couple of minutes to talk about Families for Depression Awareness. We are a national nonprofit, and we help families recognize and cope with depression and bipolar disorder to get people well and prevent suicides. We believe that depression and bipolar disorder affect the whole family, so everyone should get the attention that they need. We see the caregiver as the linchpin because not only will they recognize that there is a problem, they will be motivated to do something about it, and they will be in a good position to access resources to get a loved one the care that they need. Our website is a trove of information and resources available to help caregivers dealing with any mood disorder. Please plumb its depths and find information that is useful to you. We have tools that are online, including our mental health family tree, which is useful for helping to diagnose bipolar disorder. We have our depression wellness analyzer, which allows people to set their own wellness goals and then track how they're doing with regard to them. And also our depression and bipolar screening test, which you can take anonymously and confidentially and print out the results and take them to your provider. We also offer other free webinars in addition to this one. We have our teen depression series, which now includes a webinar on teen anxiety. We have our stress Coping with Stress series, which includes workplace topics and also other parts of life. We have our bipolar disorder series, and we also have our More Than Mood Depression Symptoms webinar, which goes back to the areas of thinking that can be affected by depression, which we call ROAM for Reasoning, Organization, Attention, and Memory. We also have a number of publications, including our new handbook, which is helping someone with depression or bipolar disorder. We have always provided family stories for inspiration and to reduce people's sense of being alone. And we have new brochures of stories with regard to adult depression and with regard to adult bipolar disorder. We thank our volunteers for their participation in those. They are truly generous in sharing their stories with us. The Coping with Stress brochure is something that I can send to you if you take our survey. And also our Adult Depression Wellness Guide provides a lot of valuable information and gives people a way of monitoring their treatment. I would like to say a big thank you to the people who have helped us in putting this webinar together. Joanne Cohen-Veda and Dawn Flores were great volunteers for applying their expertise so that we could offer you this information. Suzanne Curry is co-director of policy and government relations at Healthcare for All. She also was generous in her review. And our presenters, Becky, Hannah Frigand, and Wells Wilkinson, and the organizations Healthcare for All and Health Law Advocates were very supportive of us getting this done and out to you, and we thank them. Also want to thank our program sponsors, the Allergan Foundation, the Commonwealth of Massachusetts Department of Public Health Suicide Prevention Program, and the Takeda-Lundbeck Alliance. Our corporate members also support all of our programming, and those include Janssen Neuroscience and Sage Therapeutics. I'd also like to thank you. You've just spent a whole bunch of time with us, and we appreciate your interest. Our work is made possible by generous contributions of people just like you, so please consider making a tax-deductible contribution to us at familyware.org/donate. We appreciate it. To wrap up, please complete the survey at www.surveymonkey.com/r/healthins2019, and we will send you that brochure. Please watch the caregiver and insurance videos on our website and on our YouTube channel. While you're at the YouTube channel, please subscribe and like us on Facebook, follow us on Twitter, and share. We appreciate you sharing our social media posts as well as webinars like this. If there's anyone you believe would benefit from this information, just send them a link and they can access it for free as well. And explore our site, familyware.org, for more about mood disorders and being an effective caregiver. We greatly appreciate your time and your interest. Thank you again. Take care.